Hello and welcome to Athletic Therapy Now, a podcast for athletic therapists by an athletic therapist. My name is Ashley Burr and I will be your host. Thank you for joining us today. All right, welcome to episode 11 of Athletic Therapy Now. Today we have our guest, my colleague, friend, and co-author of the workshop Minimalist Footwear, Health, Performance, and Therapy, Nathan Simon. He's a certified athletic therapist in Winnipeg, Manitoba, and also a recent grad of the DEFT program.
Yeah, that's right.
Very exciting. Do you want to tell us what that is?
Sure. So the DEFT program is the Diversity and Equity Fire Training Program, and it is the third iteration, the third year it has been around. Unfortunately, sounds like it may also be the last year, but it was a great opportunity for folks of diverse backgrounds to get their fire training, their firefighter level 1 and level 2 here in Winnipeg, instead of having to go to the Manitoba Emergency Services College in Brandon, which is where most folks have to go in Manitoba if they want to become a firefighter. So it provided an excellent opportunity. It's a satellite of that Brandon College, so we still get all our certifications from there. We go there. We have been going there on weekends to do our practical exams and live fire drills and all that jazz. But it's a great opportunity. We had 16 of us graduate, and it allowed us to take our training while we're here in Winnipeg while we continue to work full time for myself in athletic therapy. So great opportunity. It was a great experience, and I'm glad to be done and looking for a job now in firefighting to supplement the athletic therapy income streams.
Well, that's very exciting. Congratulations.
Thank you.
So Nathan's been on the podcast before. If you want to hear a full bio or hear more about what Nathan has to say, he was on the podcast episode 6. And I believe it was called just Minimalist Footwear, and you can find that where you're listening to this podcast now. Today, we are going to be talking about common injuries related to footwear.
Mm,
So, Nathan and I have this workshop coming up in October, the Minimalist Footwear Health, Performance, and Therapy. And in that, we've been looking at a lot of common injuries typically found that are created by our typical runners that you would normally see the narrow toe box, the heel lift, the typical runners you're going to see everybody wearing in a gym, not a minimalist running shoe. And we're going to talk a little bit about what we see in research and what we've noticed in clinic. So I'll get started on that if that's okay with you, Nate.
absolutely.
Yeah. So there was a research article I pulled out by Altman et al. And also Hollander et al. So 2012 and 2019. And both of them talked about how the most common areas of injury in runners who wear your typical running shoes, starting off at the knee, going to the lower leg, foot, upper leg, and that would start with the patellofemoral pain syndrome. So we're looking at pain under that patella, iliotibial band friction syndrome, moving on to tibial stress fractures, plantar fasciitis, and Achilles tendinopathy.
Mhm.
And the interesting thing that I pulled from one of the articles, several articles, was that the incidence of injuries in shod runners, so runners wearing your typical running shoes, is 19 to 79%. So what that tells me is that I mean, that's that huge range, that huge number just tells us that it's severely underreported.
Mm,
Um, I mean, I can say I'm a runner, and the amount of times I have injured something, I mean, I never report it. I've never gone
mhm.
anywhere to be like, I'm injured. I just
Right.
power through and do the typical runner thing. So, um, Nate, why do you think it is that we note those injuries in running shoes versus
Mm.
less of those injuries in somebody who is practicing a minimalist footwear type of running?
Right. Yeah, and there's going to be a fair amount of speculation here, but some of the things that we can definitely say is that the forces that act upon the body are fundamentally different with folks running in barefoot shoes versus folks running in the modern, since the 70s running shoe with a bunch of cushion. Because in part we are forefoot striking in the barefoot shoe versus a heel strike in the minimalist shoe. Um, so the heel strike creates a massive force initially with ground contact, uh, whereby that force is being translated directly up the chain. So up from your heel bone, up your shin, your tibia primarily, and into the knee. Um, and we don't see that same jolt or that same rapid increase in force acceptance with the forefoot strikes in the barefoot shoes. Again, we'll talk more in depth about that in the course, but just all that to say that when we strike the ground with our foot, we tend to absorb and accept force in a more gradual manner, and that translates to less of a jar up the chain, up the knees, up, and we can go further, obviously, talking about its impact on the spine and even the neck. But I'd say that would be one of the main reasons why we see, especially things like stress syndrome, um, plantar fasciitis, not as much. That's I think more to do with the flexibility of the shoe. Um, but again, yeah, I think in huge part it's that force acceptance and smashing the heel into the ground, even with that cushion, still translates immense force through the rest of the body.
Yeah, absolutely. And then you had said that this is speculation, but I mean the research is showing that a shod runner typically will heel strike,
Mm,
and that heel strike causes more forces up through the tissue, or not. We're not as efficient of runners when we're heel striking.
mhm,
And whereas when somebody is a barefoot runner or a minimalist runner, we're typically a forefoot striker. And just like if you were to stand up right now and you jump and you land, if you're not wearing shoes, you're going to jump and land on the ball of your foot. If you're
right,
wearing shoes, you'll be a little bit less careful because jumping and landing on your heel hurts. So
right,
why do we run like that?
yeah.
And
And
then
I say speculation just out of an abundance of caution, because there are some studies that are showing, increased incidences of injury in the barefoot shoes. Now I'm a barefoot shoe wearer. I'm a huge proponent of it. That's clearly why we're making the course. And I would argue that some of those studies are fundamentally flawed in the way they're designed. But I think just to acknowledge that there are some other opinions, and there's definitely differences in tissue demand in the two different types of shoes, and you're going to find potentially more injuries, but different types of injuries depending on the shoe you go with. And I think a huge part of that, especially when we talk about transitioning to shoes, to barefoot shoes or back to barefoot shoes, because we've obviously transitioned out of them at some point during our childhood, getting into shoes. That it's all about timing. It's all about the care we take with changing our body's routines and our body's movement patterns. We're not throwing on these barefoot shoes and just going to town running our 10K. So lots of caveats, lots of abundance of caution in my language. But yes, there is tons of research to support the things we're saying. We're not just pulling it out of thin air, for sure.
yeah, absolutely. And it's I was just looking off to the side because I was pulling up a chart that I had written up about the differences in risk for barefoot versus a shod or a typical running shoe. And this is all pulled from research based off of a research article done in 2020 by Carpenter et al., where they're talking about barefoot running shoes have a lower risk, and this is shown in the research, of patellofemoral pain syndrome, tibial stress syndrome, and plantar fasciitis, but a higher risk of metatarsal stress fractures and puncture wounds or infection because you're not wearing a shoe. But um, the interesting thing about that is there's also a lot of research coming out and being shown as to why there's that higher risk of, say, metatarsal stress fracture or even an Achilles tendinopathy. And that's just because sometimes we go to switch over from a typical running shoe to a minimalist barefoot running shoe, which is really just a sock or a glove over top of your foot, and we're not building our tolerance up appropriately. We don't go and run a marathon if we've never run a marathon before. We take our time and we build ourselves up 10% a week. And the same thing is to be done in minimalist shoes when you're typically using barefoot, or sorry, your typical running shoes. I don't want to name any companies or anything. um, but I mean, if you think about our runner that you're going to see in a gym, it's stiff and it's anti
It has mobility controls. So
y- yeah.
there's mobility controls to your foot. The wide wedge at the heel, even on top of the cushion. There's a lot of shoes that are now including flare, like a heel flare, which adds stability from the shoe standpoint, but it reduces the onus of your ankle to provide its own stability. So, one of the analogies that I keep making to folks as I try to explain these concepts to them is that wearing shoes like the modern running shoes, or wearing orthotics that are going to support your arch for you, take the onus off of your muscles, take the onus off of your body and your foot and your ankle to perform these tasks that it's more than capable of doing, right? And it's akin to using crutches after an ankle sprain, right? We're not going to say that crutches are evil, but there's no way you should be using crutches for the rest of your life just because you sprained your ankle once. And I think people need to treat these mobility controls and these arch supports and these cushions in these shoes. Now, there's no reason to have a narrow toe box other than performance. Health wise, there's just no reason. But all those other things, they have a place, I think, in an injury setting, in an injury environment. Because, like I said, crutches very valuable to offload injured tissue. Same with arch supports to offload injured plantar fascia, heel wedges or heel lifts to offload a torn Achilles, but you're not going to stay in that mobility restricting boot with a heel wedge for the rest of your life. You're going to wean off of it. You're going to go to rehab. You're going to strengthen those tissues again, so you can get back to a more or less normal function. Um, and on the subject of ankle sprains, we have these mobility control devices, these heel wedges, and basketball shoes are really guilty of this. They're essentially ankle sprain devices. They will prevent that ankle movement to a point, but then once you exceed that point, then you have a very large, uh, an inch or so heel raise, which increases the amount of roll you get at the ankle. It increases the severity um, and dysfunction associated with the ankle sprains because you've stretched now that far. Now, on a minimalist foot shoe, you're obviously going to have very little to no heel lift and or heel to toe drop, and that physically brings your ankle closer to the ground. So if you do happen to roll over on it, uh, not only are your muscles going to have to activate more because there's no heel wedge to protect you, but it's not as far of a distance to travel. So the rate of injury or the intensity or the extremity of injury isn't as bad with an ankle roll in a minimalist shoe versus a basketball shoe. Now I think I've gotten way off track to your initial point there, but all that to say that there are pros and cons to having all those mobility devices in your shoe.
No, not off track at all. I think that so to add to that, there is, and I wish I had it. I don't know what the research article was, but I read one recently where they were looking at proprioception of the foot in somebody who's barefoot versus somebody who's wearing your traditional shoe, your typical shoe. And when I say barefoot, I mean no sock, no shoe, nothing, right? So, um, to make this something to understand a little bit more, think about your hands. So when we have our hands, we pick up things, we touch things, we can feel everything. If we put a glove on, like one of those magic gloves, or even one of the medical gloves, you can't feel anything the same
Yeah.
way that you can when your hand is completely bare. So we lose so much of that touch sensation.
Mm.
And the same thing happens in our feet. Now, there's no research showing, as what I'm aware of, there's no research showing the difference between barefoot minimalist shoe and shod being your typical running shoe. But you'd have to imagine it would
And just
be
for clarification, it's only typical since the 70s because It hasn't been typical for the vast majority of human existence. So, I like the word modern. I think it reflects more accurately. People think of these shoes have been around forever. They haven't, right? And I think
Yeah.
you had another point to that. Sorry to cut you off there.
No, no, that's okay. That's okay. You're right. I use typical because it's what people typically think of. That's why
Yeah,
I say that.
right.
But if we were to take our bare hand, and that's, a barefoot, you're barefoot and you're walking around, versus your hand in a magic glove, that would be more like a minimalist shoe, versus your hand in those Winnipeg winter, like super thick gloves where you literally can't even tell if you're holding a beer in your hand.
Right.
Um,
We like our
that
beer
would
in Pier Winnipeg.
that would be your typical or
Well,
modern running shoe
and
would be that.
I would take it even a step further. I would say that modern running shoes are like wearing those big winter mitts with finger splints inside them so that you can't bend any of your digits. That's really what we're doing. We've got these carbon plates in these shoes, extremely rigid soles, which is great for force translation, right? But that's taking all of the onus off of the 36 muscles we have in our foot, um, in each foot, and it's 33, 36. Anyways, it's taking the onus off of in our foot and putting it into that carbon fiber plate, which again, performance good, long run health or long term health outcomes not so good.
Yeah, and you're exactly right. It's we're not using our foot muscles. We're getting tons of atrophy. One of the analogies that I heard from Nick at the Foot Collective was, if you get into a car accident, they put a brace around your neck, and this ties in with your discussion about crutches. They put a brace around your neck. How long do you wear that neck brace? And it's as little as possible, because if you keep wearing that neck brace, you're going to lose range of motion in your neck, and you're going to atrophy, and you're going to have pain for a longer period of time. And so let's take that to our foot. If we put our foot into your typical modern shoe, where there's that motion control and you can't move your foot and you're not using your muscles because you don't need to use your muscles because it's supported by arch support, you're going to lose range of motion. Your foot's going to become stiff and your foot's going to become weak. So, what happens is we take our foot out of that motion controlled, supported shoe, and we go in the summertime and we put our flip flops on and we go for a 5K walk.
Mm,
And then we blame it on the sandal because now we have plantar fasciitis. When
mhm.
really, it's not the sandal's fault. It's because you walked 5K using muscles that you haven't used in years.
Yeah, and to take it even a step further with the flip flops without any sort of heel control, it changes again the fundamental way you walk and interact with the ground. There's more of a clawing action with the toes to keep the flip flop on your shoe or on your foot rather. So I think just people need to think more about what they're doing with their feet, uh, and that will inherently diminish the amount of time they spend, and the amount of money they spend on rehab and solving all these very preventable problems.
Totally agree, Nate. I totally agree. So I'm gonna pull this back to our original. Both of us went off on tangents there, and I think that's why we're doing this course, is just because there's so much that we could talk about with it. But what we really wanted to talk about was what typical shoes, modern shoes, have a high risk of injury with,
Hmm. What type of
correlation with.
injuries? Yes, exactly. Yes, I think we
Apparently,
knew what you were
words are just
saying.
hard today. Yeah, thank you.
Ashley's dealing with a lot of allergies today, so you'll have to forgive her. She's hopped up on those allergy meds, but she's
Yeah, yeah.
she's trugging through it like a soldier.
Yeah, it's been great. So we're looking at, patellofemoral pain syndrome. There's lots of research out there to show, and lots of clinical research out there to show that, switching over to a minimalist shoe helps to decrease that knee pain. And that, in part, without going into too much detail and taking up too much time, is just essentially when we are out of that modern shoe with a heel lift, we're changing our gait pattern, and that takes less. We're more efficient, so we're not using our quads as much. We're not putting as much stress on the knee, and so that decreases that tension in there. Same thing with the iliotibial band And like you talked about with the tibial stress fractures, and why we get that, it's the amount of force that we're getting when we take a step, when we're running in a shoe that has that heel lift that forces us into a position where we're going to heel strike. And so then switching over to a barefoot shoe, we are forefoot striking, and we are reducing the amount of impact loading, and we're reducing the stride length of our run, of our gait,
Mhm.
when we're in a minimalist shoe, which helps to decrease all of that.
Hmm. I think we got through the force impact on the tibial stress. Just a quick note on the patellofemoral pain and the loading through the quad. I think a lot of people are familiar with squatting modifications. So if you want to more heavily load the quad, you typically would raise your heel. If you want to more heavily impact the hamstring, you would drop the heel. And so that changes again the biomechanics up the chain, changes the demand on the muscles. So you're essentially with the heel lift, you're walking around in that quad dominant squat position. So for all our personal trainers out there or folks that are in the gym, that may resonate more to you. That may make a little more sense. And then just another aside about uh, not the shin splints or the medial tibial stress syndrome. Um, that appears to be in part due to the lack of lateral movement through the foot. So the supination pronation that happens as we absorb force naturally in a barefoot environment, it can't happen because of all those motion control devices in a modern running shoe. So not only are your arches weak, potentially weaker than they would be without a modern shoe. But your foot is physically not able to perform that pronation and that load acceptance that it normally would. So you end up with again shortened, stiff, painful lower leg muscles. Like your tib post potentially could be a culprit, and all the other muscles in the back of the calf that could benefit from being extended and being shortened through that pronation action as you accept load. That these are all contributing factors, and I think that there's just so many of those factors that compound over the years that's why we're seeing that higher incidence, that very indescript 19 to 79% of injuries with with the shod runners.
Yeah, absolutely. Thank you for those. Those were great ways to kind of wind that in and compare that to what we see in the gym and how we use it in a positive way, how we
Mhm.
use the heel lift. So thank you for that. Um, and I think we'll kind of wrap this up, and we've kind of already done our own little recap on what we discussed. But I'd like to finish with an action item.
Mm.
So the action item I would like to finish with today would be, if you typically wear zero shoes, or sorry, if you're typically wearing runners in the home, or if you're wearing sandals or whatever you wear in the home, try and spend 5 minutes barefoot. If you have a client that has knee symptoms or foot symptoms, and you're curious about how barefoot would affect them, tell them to spend 5 minutes barefoot. And most people will be completely fine with that. If they have zero symptoms after that, then increase that time
Mm.
by a couple minutes. If they have, some tension, DOMS type symptoms, stay at the same amount. If they have an increase in symptoms, then decrease it by a couple minutes. Maybe they only spend 2 minutes barefoot. That would be the person that you see that has never spent time barefoot and is always in shoes.
Mhm.
But most of the time, if I ask a client to try this and just in their home, I'm not trying to make all my clients barefoot clients. I
Right.
don't push it on anybody. Just those of my clients who are interested, we have that conversation.
Mhm.
But um the clients that I see that are, super flared up, we have to calm it down before we can start integrating
Right.
barefoot time, right? That's where that crutch comes into place, where,
Mm.
yes, you need to wear an orthotic right now. You should be wearing supportive shoes right now. Let's calm it down. And then after that, let's spend 30 seconds barefoot. Let's spend a
Mhm.
minute barefoot. Let's build it up that way.
Yeah.
But with our clients who aren't flared up, where it's a little bit more chronic, that's where I get them to start at that 5-10 minute timeline.
Yeah, and I think that's rehab in a nutshell, right? Is finding out where they're at and starting from there and building up progressive load, right? Um, the my mom, for example, she is, I won't give her exact age, but she's older than me, and obviously, and she is looking at switching into the barefoot shoes and concerned that it's going to be too much for her. And I said that's a totally valid concern, and you still have your other shoes you could mix in one day on, one day off, if that's what you want to start with. I know you may have different opinions about this, but I'm totally okay with her tossing a arch supportive orthotic in her barefoot shoe to start, right? So you still get the benefits of the wide toe box, you still get the benefits of the zero heel drop, and you give your muscles, your arch muscles, a little bit of a break or an easy introduction. So just, I think, being flexible, pardon the barefoot pun, but being flexible with your approach as a therapist, as a clinician, and meeting people where they're at, and explaining to them why this might benefit them, and then just giving them steps to get there. I think barefoot shoes is a super great opportunity, because of the amount of time we spend wearing shoes in our day-to-day lives, that it's just such a great passive therapy for folks to do, and it doesn't take a whole lot of extra work, which people tend to not like, as a whole. Folks want an easy fix. They want something they can do passively, and wearing your shoes, short of being in your sleep, is about the most passive thing you can do. So by changing your footwear, by changing your understanding of how your feet interact with the ground, I think that's a pretty, easy and effective, and it's going to have a huge impact on your overall health, lower body, right up to the base of your skull, right? So I think that's a great action item, right? Spend the 5 minutes, start small, start with where you're at, build that up slowly. As a clinician, help your client to gauge what's too much and what's not enough, and to keep them in that pocket of the said principle, that specific adaptation to those imposed demands.
Absolutely. And so, if you're interested in hearing more about minimalist barefoot shoes, you can listen to the episode 6. You can take a look. The links will be in the show notes. You can take a look at our course that's coming out October 6th. It's an in person course, so you do have to register ahead. It's a 4-hour workshop. We're going to get into a little bit of anatomy, just enough to understand it, a little bit of a recap for those of us who have stuck up with our anatomy. We're going to get into the biomechanics of your barefoot shoes, your typical shoes, the comparison in there. We're going to get into injuries, common injuries and concerns, so more in detail of what Nate and I talked about today. And then we're going to talk about some exercises that can help with your clients who have some of these foot concerns, and integrating all of this into your client's lifestyle. So that again is on October 6th. You can hop onto the link in our show notes or over onto my website, barathletictherapy.com, and the registration information is all in there. Thank you for joining us today, Nate. Was there anything else you wanted to add?
No, thanks for having me. You can find me as well on Instagram at the real Nate Simon. I have a link to my bio there to all the same good stuff that Ashley's website is one of those links. So check it out, and we'll see you October 6th.